If you or someone you love is living with diabetes, heart disease, COPD, arthritis, kidney problems, or any long-term health condition, then stay with me for the next few minutes, because what I'm about to share could completely change the way you understand Medicare. Most seniors think they know what their Medicare plan covers, but when it comes to chronic illnesses, the real story is often very different. Today, I'm going to walk you through what coverage you truly get, what surprises most people, what hidden benefits are available, and how you can avoid the costly gaps that catch thousands of seniors off guard every year. And I want you to listen closely because by the end of this video, you will understand your Medicare benefits better than most people working inside the system. Chronic conditions are something millions of Americans deal with every day. They don't go away. They don't wait for open enrollment. They don't pause when your budget gets tight. They need consistent care, regular doctor visits, ongoing medications, and long-term management. And that means Medicare plays a much bigger role in your life than you may realize. The challenge is that Medicare's rules can feel confusing, and for seniors living with long-term illnesses, that confusion can cost real money, sometimes hundreds of dollars a month, without you even realizing it. That's why it's so important that you understand exactly where Medicare works in your favor and where it leaves you exposed. Let's start with something many people don't realize. Medicare actually treats chronic illnesses differently than short-term medical issues. When a condition is long-lasting, Medicare has unique programs and support systems designed specifically for you. But here's the truth nobody tells you. These benefits only help if you know they exist and use them. Most seniors don't. That's why your medical costs feel higher than they should. That's why your care sometimes feels scattered. And that's why you may feel like you're trying to manage everything alone. If you're dealing with diabetes, Medicare covers a wide range of services, but most people don't use half of what they're eligible for. Blood sugar monitors, test strips, insulin supplies, foot exams, yearly eye exams, screenings, and even special medical nutrition therapy can all be covered depending on your plan. But the biggest change in recent years is the cap on insulin costs under Medicare Part D and certain Medicare Advantage plans. So if you're paying high insulin bills right now, that's something you should never ignore. Many seniors simply stay on the same plan they picked years ago, even though their needs have changed. Chronic conditions change your coverage requirements, and staying on the wrong plan can be one of the most expensive mistakes you'll ever make with Medicare. Heart disease is another condition where Medicare coverage can be far more helpful than you think. For heart conditions, Medicare covers diagnostic tests, ongoing cardiology appointments, cardiac rehab, monitoring devices, and a wide range of medications. But what most people miss is how important Medicare Advantage supplemental benefits can be if you have heart issues. Many of these plans include transportation to medical appointments, meal support after hospital stays, remote monitoring programs, and even fitness programs that help manage heart health. If your condition limits your activity or energy, these benefits are often not just helpful, they're life-changing. Yet many seniors don't even realize they qualify for them. Now, before we go deeper, I want to quickly pause and ask you for something important. If you're finding this information helpful so far, make sure you stay all the way to the end, because later in this video, I'll share a set of Medicare strategies specifically designed for seniors with chronic illnesses. Most people never hear these strategies, and they can dramatically reduce your out-of-pocket costs throughout the year. And if you're new here, this channel, Medicare Mentor, is dedicated to helping seniors navigate Medicare with confidence, clarity, and real-world understanding. If you want to avoid mistakes and get the most from your benefits, you're in the right place. Now let's continue, because what comes next is something almost no one explains clearly. Medicare does not cover chronic illnesses equally across Parts A, B, C, and D. Each part plays a different role in your daily health, and if you don't understand how they work together, you're probably paying too much. Part A covers hospital stays, skilled nursing, limited home health, and hospice. For chronic illnesses, Part A steps in mainly during serious flare-ups, complications, or hospitalizations. For example, if someone with COPD has a breathing crisis requiring oxygen support, Part A helps with inpatient care. If someone with heart disease needs a pacemaker or surgery, Part A covers the hospital portion. But here's something critical. Part A doesn't handle the day-to-day management of your chronic illness. That responsibility falls to Part B. Part B is where chronic illness support truly lives. Part B covers your doctors, specialists, outpatient treatments, screenings, durable medical equipment, physical therapy, and preventive care. Chronic illnesses require consistent management, and this is where Medicare puts most of its long-term support. For example, if you have diabetes, Part B covers your glucose monitor, test strips, if not under Part D, foot exams, and certain lab tests. For arthritis, it covers physical therapy. For COPD, it covers nebulizers and oxygen equipment. For heart disease, it covers cardiac tests and specialist visits. But here's the catch. Part B also comes with a monthly premium, deductibles, and 20% coinsurance. And this is where many seniors with chronic conditions get financially overwhelmed. That 20% may not sound like much, but when you're going to doctors several times a month, having tests done regularly, or using certain medical equipment, it adds up fast. That's exactly why many seniors choose Medigap. Medigap can cover that 20%, saving seniors with chronic illnesses thousands of dollars per year. The more chronic care you need, the more valuable Medigap becomes. For seniors who rarely use healthcare, Medigap may feel unnecessary. But for someone with diabetes, COPD, or heart conditions, it can be one of the smartest financial decisions you make. Part D is where chronic illness medication costs come into the picture. This is the part that confuses almost everyone. Every Part D plan has its own drug list, called a formulary, and if your chronic condition requires expensive medications, especially brand-name drugs, you must choose your Part D plan extremely carefully. If you're paying hundreds of dollars per month for medications, there's a very good chance you're on the wrong plan without realizing it. Many seniors stick with the same plan because they don't want to switch, but every year the drug formularies change. That means a drug that was affordable last year could suddenly move to a higher tier the next year, and your cost could double or triple. Seniors with chronic conditions should review their Part D coverage every year during open enrollment. Even a small change in your drug list can save you hundreds of dollars. Now let's talk about something that has become incredibly important for seniors with chronic conditions. Medicare Advantage Chronic Condition Special Needs Plans, also known as CSNPs. These are Medicare Advantage plans specifically designed for people living with certain chronic illnesses, including diabetes, heart disease, lung conditions, kidney disease, and more. These plans offer tailored benefits like special care coordinators, disease-specific drug coverage, enhanced monitoring, and additional support programs. They can even include benefits like nutrition support, transportation, and in some cases, even home-based care services. These plans are not available to everyone, but if you qualify, they can provide more support than traditional Medicare alone. One of the biggest misconceptions seniors have is that Medicare does not help with long-term care or daily living support. While that is mostly true, Medicare does not pay for long-term custodial care. It does offer certain home health services when medically necessary. For chronic illness patients, this can include skilled nursing, physical therapy, occupational therapy, speech therapy, and medical social services. But these services must be ordered by a doctor and you must meet the qualifying criteria. The mistake many seniors make is thinking they need to be completely homebound to get home health care. In reality, the rules are more flexible than most people believe. If your condition makes leaving home difficult, Medicare Home Health could be available to you. Not using it means missing out on meaningful support that could make your life easier. COPD and other respiratory conditions are another major area where Medicare coverage is often misunderstood. Medicare covers oxygen therapy under Part B, but only if you meet specific oxygen level requirements. It also covers nebulizers, inhalation medication, and certain types of ventilatory equipment. But equipment suppliers often give incomplete information, leaving seniors confused about what's approved and what's not. The truth is that if your doctor documents medical necessity correctly, Medicare usually covers far more than most people expect. Arthritis, chronic pain, and mobility issues are also incredibly common in seniors, and Medicare has specific coverage that can make a big difference. Physical therapy, occupational therapy, joint injections, certain pain treatments, walkers, canes, wheelchairs, and braces can all be covered under Part B. But here's the key. Medicare requires ongoing documentation to prove that your therapy is helping you maintain or improve your condition. Many seniors abruptly lose coverage simply because the documentation wasn't clear enough or the provider didn't update it properly. It's not because Medicare denied the treatment, it's because the paperwork wasn't done correctly. Knowing this can help you push for proper documentation. So you don't lose coverage you genuinely need. Now I want to talk for a moment about something deeply important. Financial protection. Chronic illnesses can break budgets. Between prescriptions, doctor visits, equipment, transportation, and everyday medical needs, even a small mistake in your Medicare setup can cost you thousands of dollars a year. That's why understanding Medicare is not optional. It's essential. And this is exactly why channels like Medicare Mentor exist. Seniors deserve clear, honest education without sales pressure, without confusion, and without complicated jargon. Your health is too important for guesswork. If you're still with me, it means you're serious about protecting your health and your wallet. So here's the part I promised you earlier, a set of powerful Medicare strategies every senior with a chronic illness should know. Strategy 1. Compare your drug plan every single year during open enrollment. Even if you feel like your plan is working, drug prices change constantly. Never assume last year's plan is still the best one for you. Strategy 2. If you have multiple chronic conditions, or a condition like diabetes or heart disease, check whether you qualify for a chronic condition special needs plan in your area. These plans exist specifically to coordinate your care better and reduce your costs. Strategy 3. If you are using frequent outpatient services, consider Medigap. It covers the 20% that adds up very quickly for chronic illness patients. It's one of the strongest forms of financial protection available under Medicare. Strategy 4. Use every preventive service Medicare offers. You'd be surprised how many screenings, checkups, and follow-up visits you're eligible for that can help control your condition before it becomes more expensive. Strategy 5. If you are struggling financially, check whether you qualify for Medicare savings programs or extra help. These programs can reduce premiums, lower drug costs, and help cover deductibles. Many seniors qualify without realizing it. Strategy 6. Understand the difference between medically necessary care and routine care. Medicare covers everything that is medically necessary for your chronic condition, but anything considered routine or custodial will come out of pocket. Knowing which is which protects you from surprise bills. And now, if you're still watching, I want to share something personal from a doctor's perspective. Chronic illness management is not just about medicine. It's about reducing worry. It's about understanding what to expect. It's about building a system of support so you're not navigating your health alone. And Medicare, when used correctly, can give you that support. But you have to know where to look. You have to know what questions to ask. And you have to stay informed, because the rules change every year. That's why I encourage you to stay connected with Medicare Mentor. Every week, I break down Medicare in a way that's simple, accurate, and genuinely helpful for seniors. Whether you're dealing with diabetes, heart disease, COPD, arthritis, kidney disease, or any long-term condition, you deserve to understand your benefits clearly and confidently. And I'm here to help you do that. If you found this video helpful, make sure you follow Medicare Mentor so you never miss an update that could save you money or improve your care. Chronic illnesses are challenging, but navigating Medicare shouldn't be. You deserve clarity, you deserve support, and you deserve access to every benefit available to you. Thank you for spending this time with me today. Take care of yourself, stay informed, and I'll see you in the next video.